Thank you. Canada's healthcare system is a source of pride and a defining value for Canadians. And our government has been working collaboratively with provinces and territories to improve access to home care, mental health services for Canadians. And Budget 2017 provided, as you said, 11 billion to new targeted funding over 10 years to provinces and territories. In August 2017, provinces and territories endorsed a common statement of principle of shared health priorities that set out pan-Canadian objectives for home care and mental health funding. Could you provide the committee with an update on the ongoing work with the provinces and territories to ensure that this funding meets the needs of Canadians? I'm also a great advocate for national pharmacare. Can you give us update on ongoing work on that? And however, when Canadians living with the diseases cannot afford their medical supplies and equipment, something has to change. Please give us update on ongoing work on that.
So with respect to the investments that have been made in the area of our additional funding for mental health care and home care, to give you a snapshot as to where we're at in budget 2017, as you've indicated, we were pleased that we saw an investment of $11 billion in those two areas. We've certainly heard from Canadians that the area of home care and mental health were two priority areas, and I was extremely pleased that in budget 2017 that targeted investments were made in those two areas. As a result of that, thus far, over the past year and a half, we've been in negotiations with provinces and territories to finalize the bilateral agreements with provinces and territories. At this point in time, I'm pleased to announce that 9 provinces and territories have finalized and have signed their agreements, and the other remaining 4 provinces that remain, we are almost at the end of the negotiations, and either by the end of this year or in early 2019, those negotiations, those bilats will be completed. And as such, the monies will be flowing. But I also have to say that even before the bilateral agreements have been signed, the money has been going to provinces and territories because we certainly want to make sure that people have access to the funding that's required. But those bilateral agreements are really key because we certainly want to make sure that the money is going where they are supposed to be going. Now, as per your question with respect to pharmacare, I think there was that component as well. With respect to that area, as you're all aware, in Budget 2018, we announced the creation of an advisory council on the implementation of a national pharmacare program. Work continues to be underway with respect to that. We are very pleased that Dr. Eric Hoskins and a group of fine Canadians have agreed to sit on this committee, and they've been having a national conversation with Canadians with respect to what a national pharmacare program can look like. I look forward to receiving the report in the spring of 2019 with some recommendations of possible options as we move forward. But we certainly recognize that the work that's been done in this area is key from the Advisory Council, and I truly look forward to receiving the report with recommended options, but also a path to move forward.
Thank you. Thank you.